In the meantime, local midwives and doulas weighing in today on the dwindling childbirth resources in the capital region.
In 2011, St. Mary's closed their maternity unit. In recent years, both Columbia Memorial, Ellis Hospital also announcing they would no longer deliver babies. Now this week, St. Peter's Health Partners announcing plans to close the birthing center, Burdett Birth Center in Troy. News 10's Mikhaela Singleton sharing some insight from childbirth professionals on the possible consequences to creating what's known as a maternity care desert.
In only a few days, local doulas and midwives say they've been swamped with worried calls from parents-to-be wondering what will happen if Burdett Birth Center in Troy really does close down.
They're freaking out, and rightfully so.
Esther Patterson and Betsy Mercoliano sit on the board for BirthNet, a local birth advocacy group. They say if St. Peter's Health Partners goes through with the plan shutting down Burdett, which is the only Rensselaer County birth center, it will create a maternity care desert for parts of the capital region.
One hospital in the Schenectady area, there's 2 in the Albany area, and there's 1 in Rensselaer County. And then there's nothing between Kingston, Cooperstown, Saratoga. There's nothing else.
According to the American College of Obstetrics and Gynecology, maternity care deserts greatly affect rural populations, those with high poverty rates, and the Black and brown community.
Across the nation, Black birthing people are 3 to 4 times more likely to die than their white counterparts.
These local professionals say Rensselaer County already struggles with higher than average maternal mortality rates, which could worsen if more can't get to prenatal care without solid transportation.
I just worked with a family who didn't drive. If they weren't going to a hospital literally down the street, they had a huge problem. There are many people who don't drive, or can't afford an Uber.
They do say that you can take the bus and it'll take about an hour. I would argue that it takes probably much longer than that. By the time you get to the bus stop, get on the bus, make changes before you get to either St. Peter's or Albany Med.
Margaret Holcomb just recently retired from Burdett as a midwife. She says not only are her former colleagues worried for their jobs, nurses in the emergency room may soon be labored with even more work.
The emergency room is not necessarily a controlled environment for a birth. Plus, you also don't have, yes, you have an ER physician, but how many births does an ER physician do?
The nurses were stretched thin, and we don't want that to be exacerbated by the closing of the birth center. That makes no sense.
BirthNet plans to hold a rally in Troy on Tuesday to speak against the closure plan. Reporting in Troy, Mikhaela Singleton, News 10 ABC.